their experience of caring and the level of burden that they experienced as well, the level of support that they received, and the level of support received by their care recipient, and the support needs of the carer as well. Now, in terms of who participated in this research, so 90% of the respondents were women. The average age was 49. 47% of carers were caring for a child under 18, and 31% of carers were caring for a person over 65. 3/4 of the sample were caring for one person, and 1/4 were caring for more than one person. 1/5 of the carers responding to the survey were in paid employment, and 61% of the carers in the sample were caring for more than 100 hours a week. Now, this is 168 hours in a week, as I'm sure we all know, so this suggests that many of the carers within the sample were actually caring round the clock for their loved ones. Now, what did these carers say when we asked them about their health and well-being? So, over 2/3 of the sample said that they were diagnosed or treated for a physical health condition. Providing hands-on care can be extremely physically demanding, lifting and turning the person needing care, helping them move around the house, in and out of bed. It's therefore not surprising that back injury was also common amongst respondents, with 40% diagnosed with back injury. High blood pressure was also prevalent amongst respondents, with over 1/4 diagnosed with this. And those who, moving on to mental health, 48% of carers were reported that they were diagnosed or treated for a mental health condition. 35% were diagnosed with depression, and 39% were diagnosed with anxiety. Now, I want to emphasise at this point that we're talking about diagnosis here. So as we know, a lot of people will go untreated for anxiety and depression. People might be feeling very low, but they don't necessarily present to their doctor for treatment. So we actually think that the numbers are likely to be much higher than the 48%, which is already pretty high. 88% of the carers in the sample said that they were stressed, trying to balance caring with other family and work responsibilities. And by now, the relationship between stress and mental and physical ill health is well recognised. Stress is often behind high blood pressure, back injury and depression, for example, all of the things that the family carers in the sample were suffering from or diagnosed with. And the majority of the carers in the sample actually said that they were suffering from stress. Also important to note at this point that the study said that it's not, or the survey, the sample said that it's not only that they were suffering with their physical and mental health. Almost 7 in 10, 68% attributed their worsening health to their caring role. So all of this suggests that carers need more support to be healthy. Now, when we asked carers about the type of their access to supports and services, we found that carers in the sample were often going without vital supports. Caring often left little time for carers to focus on their own health. Now, one particular service that we know is vital to carers is Respite, and this is especially important considering that 61% of respondents cared for over 100 hours a week, and that 1 in 5 were continuing to work alongside caring. Now, despite these lengthy hours, caring, and the difficulties that people often experience in balancing care and work, we found that only 18% of cared for people had access to respite. 12% of carers said that their loved one were offered respite, but it wasn't suitable. Now, this meant that 83% of care recipients had no access to appropriate respite, meaning that they weren't getting the breaks that they needed, the carers weren't getting the time to recharge their batteries or catch up on the sleep that they weren't getting due to caring, often 24/7. And I might add at that point as well that over 60% said that they were regularly getting up in the night as part of their caring role as well. The findings also reflect the country's ongoing home care crisis, with many carers reporting that they received none or little support in the home. 3/4 of cared for people did not receive any home support hours at all. Even when home care was provided, it didn't automatically lead to a break for carers. So 1 in 7 children who were receiving home care nursing hours where the carer wasn't allowed to leave, they received nursing hours where they weren't allowed to leave the home. Now, in the past, when a nurse was in the home, parents were given a chance to leave, to go to a medical appointment, to go for a cup of tea, to catch up with friends, spend time with their children. This all changed in 2018 when the HSE introduced the in-local apprentice room. Sorry, I'm going to take some water. So, for those of you who aren't aware of the Untitled Apprentice Rule, although I think a lot of you do know about it because you're nodding your heads, but for those of you that don't, this rule requires that the parent or guardian of a sick or disabled child must be present with home care staff at all times, so they can't leave the home. Now, the finding that 1 in 7 children had home care hours where the carer couldn't leave the home suggests that the HSE's Untitled Apprentice Rule was actually impacting on some carers within the survey, further contributing to an environment where parents felt trapped in their home. So whilst home care might be provided and available, it's inadequate in the sense of giving carers a break. And if we connect this back to the National Carer Strategy, it goes against the very ethos of supporting carers to be healthy and to participate as fully as possible in economic and social life. Now, other issues that came up regarding supports and services included that carers said that there was a lot of transport issues, clearly. 22% said that supports and services, even when they were available, were simply too far away. 43% said that supports and services were not disability, condition, or age appropriate. Now, we know that carers need to feel confident that their loved one is in safe hands and receiving quality care when they're away from their loved one, from adequately and appropriately trained staff. But they said that 37 said that the quality was poor. And staff training also came up as an issue. I better move on. Affordability was also a big issue for many of the carers in the sample. So the financial strain, you can see in some of the quotes here, is palpable. Almost 3/4 of the sample said that they didn't have enough money to take care of their loved one and meet other expenses. Financial worries and mental ill health often go hand in hand, and this was certainly the case for many of the carers who responded to the survey, with mental and physical ill health significantly associated with worries about not having enough money now or in the future. Now, what all of this suggests is a system that is under terrible strain. Services for carers and the people that they care for are often inaccessible, unavailable, chronically underfunded and under-resourced, and they're often of such poor quality to be of little benefit. Now, all of these results are quite shocking in and of themselves, or perhaps they're not too shocking and confirming what many of us already know. However, what's interesting is when we look at things, how things compared to 10 years ago, when we conducted a similar study of family carers' health and well-being. We asked many of the same questions to carers, and this has allowed us to trace some differences over the 10-year period. Respondents in 2019 reported worse physical and mental health than the carers who participated in the 2009 study. There was a 70% increase in the number of surveyed carers who were diagnosed with depression. There was an increase of 30% in the number of carers diagnosed with anxiety, a 24% increase in the number of carers reporting poor health. There was also a 65% increase in those who were not able to access respite. In 2009, 56% of the carers who participated in the study were worried about what would happen if they died or they couldn't care any longer due to illness, and almost half of carers worried about not having enough money. In 2009, carers reported very similar worries, but these worries were much more pervasive in the 2019 sample, with 3/4 of carers reporting financial worries, fears about their own health and well-being too. Carers repeatedly reported in both studies that they needed more respite, more home care hours, and also counselling. So counselling was a big thing that came out of this study as well. 1 in 3 of the sample requested counselling to support them to be healthy as well. Now, overall, all of these findings suggest that rather than the situation of family carers improving over the lifetime of the National Carer Strategy, we're in a somewhat ironic situation where the carers who took part in 2019 are worse off than those who took part in 2009. They're less healthy, they have less access to vital services, they're more worried. The family carers Ireland, who I work for, has chaired the National Carers Strategy Monitoring Group since 2013 alongside Care Allowance. Now, the group found that the government has made some progress in some of their objectives under the strategy. For example, the introduction of the GP visit card, but that's only available to those who are in receipt of carers allowance or carers benefit. But over the course of the lifetime of the carer strategy alone, we've heard about the closure of multiple respite centres with no alternatives put in place. We have a situation where the mobility allowance and motorised transport scheme was pulled in 2013 with no alternatives put in place. So many carers are incurring significant costs in bringing their loved ones to the places that they need to go. In the qualitative comments in the survey, carers described the constant battle for services, the stress of lengthy waiting lists, the challenges in going from children to adult services, the strain of caring with no support. The implications couldn't be clearer. Carers who are providing so much support and value to society have been massively shortchanged despite Ireland's economic recovery over the last number of years. Now, Family Carers Ireland has been calling for a refreshed national carer strategy with ring-fence funding for implementation since 2017. And whilst we received support from Minister Simon Harris and Minister Finian McGrath earlier this year regarding a refreshed national carer strategy, we understand from recent meetings with the Department of Health that it's their intention to publish a national social care strategy within which carers will be a fundamental component. The department accept that that's going to be a few years in the making. So what we've suggested is that to the department, we're actually working with the department at the moment, to consider how priority policy actions relating to carers can be progressed in the interim. So I'll quickly go through, I don't have very much time.
No, you're okay.
Yeah,
Sorry,
I'll quickly go.
I made a mistake, so.
Oh, did you? Okay.
I was cutting you off, so. No, you're okay.
Great. Okay, so some of the policy actions, so there's about 50 policy actions that we put forward to the government as part of this refreshed national carer strategy. But I'm just going to present 4 of them here today because they relate specifically to what I presented here today. So first, we know the impact of caring on carers' mental and physical health is often exacerbated by carers going without adequate breaks. And the research shows that 83% of family carers are going without suitable breaks, or suitable respite. So whilst the Department of Health's plan to establish a statutory home care plan is welcome, we're calling for a minimum entitlement to 20 days guaranteed respite each year to be enshrined in the scheme. So ensuring that carers have access to appropriate respite is absolutely essential to their health and well-being. The support doesn't just come in the form of health or care services. Financial security is also absolutely key to carer well-being. So this our second recommendation points to the necessity of ensuring adequate incomes for caring households. 3/4 of the carers in the sample said that they were worried about how they would cope financially in the short and long term. Many felt that the bar to qualifying for financial support is currently set far too high. We heard from carers in the survey who said that they might appear financially comfortable on paper, but actually when you take into account the costs of caring and daily expenses, that they were at risk of poverty. Now, to address this, we're calling for an urgent reform of the carers allowance means test to ensure that it's more accessible to full-time family carers who exceed the current income threshold despite living on relatively modest earnings. So it's also important to identify carers' needs. The research shows that carers say they need more respite, more home help and counselling to support them to be healthy. But these needs are frequently not identified and they often go unmet. To address this and to fully recognise carers as partners in health and social care, as the National Care Strategy stated, we're calling for the HSE to roll out a nationwide carers needs assessment, one that looks at the impact of caring, identifying what support a carer and their family need. Now, the HSE have actually developed a carer needs assessment as part of a single assessment tool, but we're recommending that this be rolled out nationally and be available to all full-time family carers. Now, I'm just moving on to the 4th recommendation. The introduction of the GP visit card, as I mentioned earlier, was a welcome first step in recognising the health and well-being of family carers. But its method of delivery means that it's only actually available to a certain number of carers. It imposes a means test on carers' access to GP visit card. So in order to reach a greater number of carers and to not just limit their access based on their means, This is also in keeping with the government's own strategy of universal access. We are calling for the GP visit card to be made available to all family carers in receipt of the non-means tested carer support grant. Now, central to all of these recommendations is the idea of sharing the care between the state and families. Family carers shouldn't have to shoulder the responsibility of caring alone and without the proper supports in place. The findings from the study again underline the need for government to urgently come forward with significant and effective proposals to ensure that carers and the family members and friends that they care for get the support and services they need. We don't want to be in the situation in another 10 years where we do a similar survey and see that family carers are still suffering with their mental health, still not accessing services, and still very worried. This is why it's absolutely essential for the government to commit to a national care strategy. And whilst we're waiting for this social care strategy to be finalised. So we know that the right support can make a huge difference. And we think if these recommendations, along with the other recommendations that we're putting forward, if they're implemented, there's the potential to save a great deal of pain and cost. I'll leave it there.
Thank you, Nikki. Really, really interesting and informative presentation. And my apologies, I should learn how to count. So sorry.
Into a sweat.
And then I didn't know how to tell you that I made mistakes. Anyway, the best laid plans. You did excellently and really, really interesting. So I'm going to open the floor to questions. We've got about 10 minutes for questions. Really encourage you to throw up comments or questions to Nikki. Down at the back there. I'm going to repeat them as well, so just before Nikki answers, I'll repeat them just for the...
Audrey Dean, I'm here as a speaker for later on today, but also I work part-time for Age Action, and I'm very interested in the single assessment tool end of things, because that is a critical building block for ensuring equity, measurement, and, you know, capturing the data. Can you say a little bit more about the carers assessment piece of that? Would it be a specific kind of module within it, or?
So,
just the question relates to the assessment, the single assessment tool, and the carers section of that.
So, as I understand it, so this is only available obviously to over 65s, and the carer needs assessment will be so it's a separate instrument that is administered to carers.
Okay, yeah, that's the bit I couldn't, Okay, thank you very much.
Okay, and
Hi.
Down to back there.
Hi, I'm Brady Maloney, I'm a PhD student here in UCD. And you mentioned that the average age of the respondent was 49,
Yeah.
is that correct? And can I ask about, because I'm interested in young carers, how many of those were under the age of 18, or what was the age profile there?
Well, we didn't, the survey was for those over 18, so we don't have a young carer profile. Sorry, I should have mentioned that at the start. Just for ethical reasons, and because we were reaching out to our membership and to those who are part of. So we have a young carer programme, and there's people that are part of young carers membership, but we didn't actually include these in the survey. Yes, yeah. Now we are hoping. It would be good to kind of put this out here. We're hoping to do a survey or a study of young carers, just to kind of see some of the issues around for young carers in Ireland at the moment. But one of the things that I'm worried about, and I don't necessarily have the expertise because I haven't done research with young people before, is the ethics of actually doing a piece of research. So perhaps I could talk to yourself, or if anyone else has any ideas about doing this type of research with young carers, I'd be really interested in hearing about that. Okay.
And that question just related to the age profile, exactly, being 49, and the question related to the age profile of young carers, but as Nikki explained, they weren't included in the survey. Next question, gentleman here.
Anil Patil from Carers Worldwide. Thank you, Nikki, for very insightful and inspiring presentation. Just it is a comment. There are so many similarities out there. Carers Worldwide works in developing countries, India, Nepal, and Bangladesh. We done the survey 2 years ago in 3 states in India. Same kind of statistics, particularly in health. 61% of carers have shown the physical health issues, and 79% were mental health issues, both the depression and the anxiety. 92% of carers were worried about the financial because there is no provision from the government to support the family carers. There is no recognition. Carers are invisible. And majority of the caring is done by the women. 84% of carers are done by women. So my question here is, it's a great that Ireland government is providing support to the carers. Is there any effort being made from Family Carers Ireland to address some of these? Have you come up with any kind of program to specifically support some of the issues that you have highlighted in your study?
So the question, and thank you for that very interesting international overview. This gentleman was referring to organisations that work in India and Nepal and some of the relevant statistics, and was asking then about Family Carers Ireland's programme to deal with the issues Nikki highlighted.
Yeah, so currently at the moment we do provide respite to family carers, home care supports and counselling, but because we're not adequately funded, we're not actually able to provide this in a uniform basis as well. So one of the suggestions is that we are asking for more funding to be able to provide these services to family carers across the country in a more uniform and even way. But at the moment we don't have, so we can only administer these types of programs in places and spaces that we actually have the funding for. So, but we know from, so we did they offered counselling, one-to-one counselling and that as part of a broader programme, and that was really, really successful for the carers who took part in the evaluation a few months later. They really felt the benefits of actually being able to speak about their care situation and reflect on what's next as well for the post-caring role.
Okay, and just one more question. Sorry,
Rob Anderson, Eurofan. This is meant to be very constructive.
Yeah.
Okay. We're talking about how research can have an impact on policy.
Yeah.
And policymakers will listen to your findings and they will say, it's not a representative population of carers. So I'm trying to be constructive by saying I think we should think very hard about how to turn this around to our advantage and talk about what's the value of these kinds of surveys where you don't pretend it's representative. You're saying it's mainly women. You're saying lots of younger people being cared for. You're saying it's a particular population, but you're also saying there's a big gap between the perceived awareness of issues and the social, emotional situation of these carers. Yes, they're probably a quite high intensity caring population, but that can be presented to our advantage. I think you can also say some things, which you didn't so far, about different groups of carers within that population you're looking at, and that can be very helpful indeed. And thirdly, I really liked your presentation of change over time in the surveys looking at that have the same sort of strategy, because that's probably something you can usefully reflect on without pretending that it's representative data.
Yeah.
So very interesting comments there again. 3 points. The first is about how to turn around the information so that this isn't a representative sample, but how to use the information in a targeted way. The second one is how to break the information down into different groups. And the third is really the value of having the change over time of the two groups that were tackled in a similar way.
Yeah. I agree with all of those comments. We know that it's a convenient sample, and obviously it's carers who are self-identified as carers as well. So we're missing a whole branch of people who are maybe not at the sharp end of caring. But we are being very, very upfront about this fact, and that it is a survey of our membership and our network reach as well. In terms of the groups of carers, so this is a huge data set, and we're still drilling down into it. So I guess maybe I should have said this at the start. This is nearly preliminary results as well. So we know we haven't looked at carer relationship. We haven't drilled down into some condition specific stuff as well, because that's there in the data. So there's lots of ways. We have looked a little bit around hours of caring and found that some carers that are caring over 100 hours a week are more susceptible to mental ill health. But the issue is there that over 60% of the sample then as well are actually caring for over 100 hours a week. So this is something that's going to be ongoing in terms of the change over time. Yeah, I think this was the aim. So when we first did this research 10 years ago, there was always a hope that we would be able to repeat it, and things just kind of came together in terms of funding, in terms of the College of Psychiatrists were willing and able. At the same time, we had the buy-in from Deirdre O'Donnell to do the analysis as well for us. So, but it's definitely something that we'd like to repeat in another 10 years, with the proviso that this isn't a representative sample, that it's a convenient sample of family carers. But thank you for your comments. I think they're important issues to raise.
And thank you, Nikki. And unfortunately, I know there's some other questions in the room, but we'll have to move on. But I know Nikki is here, and I'm sure she's happy to talk to you at the break there. So thank you very much, Nikki.
You.
Sorry to get that.